Hello, I'm Dr. Maria Sulindro, specialized in integrative anti-aging medicine, practicing in Pasadena, California. Today, I have a returning guest speaker every month, Dr. Cynthia Shelby-Lane. I'm so grateful that Dr. Cynthia has helped me with this COVID and vaccine update because even though we would like to make disclaimer, we both are not immunologists, not infectious disease or pulmonologists or virologists, but we do read a lot and we treat patients that have COVID in the office. So we would like to share with you, and this goal is for community awareness. Hello, Dr. Cynthia.
Hello, Dr. Maria. Good being back.
Good. Thank you so much. Dr. Cynthia's background is an emergency medicine specialist, and she's practicing in Detroit, Michigan. She's board certified, same like me, in anti-aging and regenerative medicine. We both are practicing integrative medicine. So today we would like to update you with what we call, let me see, I think I have this just now. We will talk about the famous Delta variants that are affecting most countries in the world, including us in the United States. And I'm very sorry to see how Indonesia is getting this Delta variant since last month. And then we are going to talk about masking up again, and then back to school, very important for the children and the parents, and of course the teacher, and also prevention. So these four important things that we have to be aware. So Dr. Cynthia, let's talk about the Delta variant. I know you read a lot about this one. I read a lot about this one, and why people, the PCR swab is negative, and this has really becoming a very puzzle things for the community and also medical health providers. Go ahead, Dr. Cynthia.
Thank you. So the Delta variant is the new star of COVID, and I hate to put it that way, but we had the Alpha variant. So we have COVID-19, then you have the Alpha, you have Beta. This is all in the Greek alphabet. You have Theta, I think Theta, Alpha, Beta, Gamma, and then Delta. And so Delta, so it originated these variants out of the UK, then South America, South Africa, and then India. So India is responsible for this new, very transmissible Delta variant. And that's where the origin is. And that's why we talk about it so much, because it is so transmissible. It is, it alters the spike protein. And therefore, if you were vaccinated versus not vaccinated, you are equally at risk for this variant and for this virus. So it's still, because it's so transmissible, we're seeing an uptick in cases, and we're seeing, but those who are vaccinated, a decrease in death. So you have a sort of a balancing act that you have going on here, because you and I already spoke, only about 50 to 60% of the US population is actually vaccinated. We're starting to vaccinate children, but this variant can escape vaccination and especially the unvaccinated. So I think people have reached a sort of personal interest story now. They're sort of believing that it can't happen to me. I had the vaccine, but that's not true. So we're going to go on and talk about who's at risk and who's not at risk.
Yes, thank you so much for reviewing about Delta variant, which we already did last month. And then for this, do we have any study done, and who is at risk of Delta variant COVID and who is not at risk? So this must be, you're covering about these vaccination things.
Right. So the people who are at risk now, so what the country did in America was they said, let's take the people who are the sickest and let's vaccinate them, because they were dying the fastest. So those people were vaccinated. And then they said, well, what about the healthy people? So they left the healthy people until the end. And so some of the healthy people said, well, I didn't get the vaccine, or I got COVID, and I think that my antibodies of my own body, my innate and acquired immunity, are protecting me. But at this point, the vaccinated and the unvaccinated are both at equal risk. That's because if you're vaccinated, you may be asymptomatic. You won't even know that you have the virus, and you won't get tested because you're not very sick. So let's go to what the CDC recently did. They recently put out a statement because there was an outbreak. There's been 3 major outbreaks that should be looked at, but the CDC July 27th said that according, and I'm going to read this, according to a recent document from the CDC, which was leaked, actually was leaked. So, it's not easy to get this information, but it was leaked. And it says Delta is much more contagious than prior strains have been and leads to more serious illness. And they released their paper and documents on the findings from a recent outbreak in Barnstable County, Massachusetts. And this was a county that was pretty much vaccinated people. And on July the 1st, there were 0 out of 100,000 cases, 100,000 testing for COVID. On July 3rd through 17th, there was a major outbreak. People went to the hospital. They were vaccinated versus the unvaccinated. The vaccinated got sick, but they didn't die. The unvaccinated went to the hospital and were hospitalized and became sicker. So the vaccination protected those, but they still got the virus. And many of them were not wearing masks. They were in outdoor areas, they were indoor areas. And when the CDC looked at that, and this is the only study that's been released, so you can look it up, cdc.gov, and you can look at the study that they presented about Barnstable, Massachusetts. So this is a major study that was just released, and even since I talked to you. So the CDC director is urging people now to mask up again. And she is telling people that this is very dangerous because it can't necessarily be detected. You and I talked about the PCR test where it can't be detected in the nose or the mouth. It goes right into the GI tract. You want to talk about that?
Yes, please.
Okay,
Yes,
you can go ahead.
Oh, okay.
Yes.
Yes. So basically, this Delta variant, they don't like to sit around in your nose and in your throat. They go directly to the lung, and some of them even go directly to your gastrointestinal area. So many of these people are sick with the stomach pain and cramping, and some of them actually do not have diarrhea. Some of them have constipation. So it is very confusing for the patient, and some doctors think that they might have like anything with itis, like colitis, cholecystitis, and things like that. But actually, because when they test the PCR, the swab, it's negative. So that and it went so fast that some people who are not vaccinated, of course, and they are sick, and they need severe therapy. And apparently, according to the Dr. Cynthia, that the CDC says that all people that are sick and got hospitalized, very small percentage died.
Correct.
But the non-vaccinated more gets the mortality is higher.
Right.
Right.
Right. So we're spreading the virus, whether we know it or not. And that's because we have loosened up our behavior as human beings. So you got the virus, you got the vaccine, you didn't have COVID, you don't feel sick, social distancing was relaxed, masking was relaxed. I think the community is pretty confused about what to do. And so if you believe you got vaccinated and you believe you're protected, there's no vaccine that's 100% protective, not even for flu or any of the vaccines that are out there. So in this scenarios that I spoke about, Barnstable, Massachusetts, there was a wedding that you and I talked about in Texas, where I think the people flew in from India. They brought the Delta variant with them. 4 of them, 92 people, they were presumably all vaccinated. 92 people got sick, and 4 went to the hospital, and 1 of them died. So it's like, this is such a mysterious thing that we still have with us. So we're not out of the woods. We're still deep into Delta, making us wonder as scientists, as doctors, as patients, what should we really do, and how should we control our behavior? I mask up most of the time. There was a questionnaire for physicians on a Medscape for emergency physicians. It says, when you're at work, are you worried about giving COVID to your patients? Well, no, I'm not, because I'm double masked. But are you worried about your patients giving it to you? Yes, I am, because they won't mask up, and they don't believe it, and they can't breathe, and there's all sorts of reasons why. So even though I have plexiglass. Number two is, when you go out, do you mask up? When you go to indoor settings, do you mask up? When you go to outdoor settings, do you mask up? Some 4% said, I never wear a mask. These are all physicians. I don't know if they're vaccinated or not. Most of them, I think, were 37% were over 65. So probably the fearful, such as myself. But it's our behavior that's going to make this thing go away. So number one, it's going to be about vaccination, whether you want it or not, anti-vaxxer, hesitant, resistant, whatever you do. But we're going to talk about prevention at the very end, because vaccinations, masking, social distancing is not all that you can do. And that's what people say all the time. What else can I do, doctor? I don't want the vaccine. What else can I do? How do I protect my immune system? So we're going to talk about that at the end. So the other scenario was in Israel. So there was the Massachusetts, there's Israel, and there is India, the wedding in Texas. But the Israelis have found that there's been an outbreak of 40% of people who are vaccinated are still getting COVID in Israel. So everybody's all over the planet. They're looking at people, they're doing their studies, they're doing their testing. Delta is the demon or the culprit right now. So
yes, because there is no treatment or medicine for COVID yet.
Right.
And vaccine is not the treatment for COVID. And people always think that vaccine is the treatment for the COVID, but then what we have available now is not protecting us from this new variant.
Right.
So people cannot be too relaxed, even though your antibody is 13,000, 15,000. The other day I saw my patients with antibody more than 10,000. I was very impressed. And I said, you still have to mask up. And I'm just curious what you think about this masking up, because the school is now opened. And there is always a myth that if they even have a mask, they cannot get COVID, which is not true either. So can you please comment on that one? I feel sorry for all the children that have to wear masks, and they are like under 5 years old. They drop off in their preschool. Yeah.
Well, the other thing about the Delta variant is 1,000% more transmissible. That's right. I kept reading and reading. It's more transmissible, 1,000% more. So the viral load is just increased. So this is something that's not to be taken lightly. And the thing is, people might get sick, they might not get sick, and you won't know. You just won't know if you have it. So if a group of my friends, comedians, they went to a comedy contest in the Midwest. And presumably all of them were vaccinated. It was 34 in the contest. By the time day two came around, one guy wearing a mask said, "Oh, I just have a cold." And then he took his mask off, and they were all tightly surrounding each other in a comedy club. Well, 19 of them came down with COVID.
Wow.
My friends who talked to me who were vaccinated said, well, we felt like we didn't feel real bad. We felt like we had a cold. We didn't feel good, but then it lasted for 2 days. And then they got tested and they had COVID, the Delta variant.
Oh, wow. So 70, 30,
yes.
50% got COVID because of one person.
But one person that spread it around, and they were indoors, they were unmasked, and presumably they thought they were all safe. And this is one of those indoor areas that the CDC is saying you can't be indoors or outdoors, because Massachusetts was outdoors. It was at events and at, people having a good time over the 4th of July weekend and going to vendors. And so you're buying hot dogs, or you're doing whatever you're doing and having fun. And people got really sick in Massachusetts.
And they were all masked.
No, and in Massachusetts, no, they were outdoors, outdoor vendors, because everything is
your comedian club.
They were unmasked because they thought
unmasked, indoor.
Unmasked indoor, 34. They said they were sitting tightly next to each other. Like, well, I said, well, you know what? I'm scared again. because I'm in the clubs all the time. That's what I do, for my part-time.
Yeah.
So this is something, and I've been back on stage again. I'm going to sit away from my comedian friends. I'm not going in the green room, and I'm going to mask up. So let's talk about kids. The CDC said kids have to mask up for the fall.
I know.
They have to mask up.
That must be very hard for the kids.
Yeah. And so we talked about,
I don't know how you make the kids wear the mask all the time when they have a break and, they have to eat.
Yeah. So I think in the population of worlds, in the world of school, they're probably going to say, are you vaccinated, unvaccinated? They're probably going to separate. It's going to be a little bit of a mess in the beginning, and it's going county by county, state by state, and we're going to see how it's going to work. And the thing is, the teachers are coming back, and the teachers would usually worry about getting some of those pesky little viruses from the kids.
Mm-hmm.
Now the teachers are vaccinated, but they may be able to pass it on to their kids who are unvaccinated, because you see this Delta variant doesn't show symptoms all the time. You may be vaccinated with no symptoms at all, but you still are transmissible. You can easily transmit this virus just like people who are unvaccinated.
Very dangerous, right?
Yeah, so this is what the question was, and I found this pretty fascinating. It says, are the Delta variant in schools, is rapid testing the answer? So if they do PCR testing, it's very expensive. It costs about, for the United States to put this program together, $11 billion to put that together, to test the kids on a weekly basis. 40 weeks, test the kids, PCR. But they could do rapid testing, which is 15 minutes and is less expensive, but it misses 40% of the people who are positive.
Many people do antigen. That's the rapid testing, right?
The antigen test, yeah. Mm-hmm. But it misses 40% versus PCR.
I know.
So we have a cost. The cost to be safe versus the testing, and we're just going to go with what results we got, because it's $11 billion. There's 156 million school children.
Oh my gosh.
I don't think it's that many. I think they said 156 million. It's a lot of kids.
A lot. Yes.
Yeah. And so parents are going to be concerned.
Yeah, it's not just the pandemic now. It's really like at the very top, a problem of the pandemic, which, we just got released from everything on June 15, and now we are going back slowly to where it was. So people are very angry and mad at everything. Yeah. At no reason they got mad, actually. Now, in that case, maybe we should just touch also the vaccination for the children program in United States. I know a different country do not have it yet.
Right.
It's the vaccination. Yeah.
It's a clinical trial. I didn't hear you.
The clinical trial?
Yes. So clinical trials were completed for 12 to 17-year-olds, and children, teenagers, 12 to 17 are getting the Pfizer vaccine. They are getting single dose, double dose. The issue about myocarditis is still an issue. So you always have to talk to your pediatrician. Presumably pediatricians are up to speed and up to date on whether your child should have the vaccine versus not get the vaccine, versus what are your underlying medical conditions. My grandson's 15, and we called the pediatrician. They were of a little bit of it in terms of what to do. They said, well, he doesn't have any problems. Yeah, get the vaccine. Everybody's coming. Everybody's getting it. That's not the answer you want to hear. Mm-hmm. You want your pediatrician to really look at you and personalize whether you need the vaccine. Are you at risk? All children are not made the same. So each pediatrician will probably have to go through their medical record and decide. But most vaccines are not being given in pediatricians' offices.
Cynthia, I think it's been delayed, right? Because this is what I heard. The myocarditis, I don't know what you read, but this is what I read. The myocarditis is not happening to the children that has a premorbid. It's not. They just, no, they get myocarditis. So this is why it worries the family. But then the parents ask the pediatrician, And the pediatrician said, well, there is a small percentage of the children will get myocarditis. Now, they have to decide. I mean,
Yeah,
the parents have to decide. It's very
right.
hard.
Right. It is very hard. And so I think because parents are pretty astute now, they know what's going on. You can't just take the vaccine and call it a day.
Right.
It's not like all the required vaccines. This vaccine is still emergency use authorization. It can't be forced upon anyone. Physicians need to be aware of who it will work for, who it won't work for. I'm not a pediatrician. I don't give out the vaccine at all. So I just know that when you go in as a parent, or caregiver, that you're going to ask the right questions. Should my kid get it? What's the risk of them getting myocarditis? What is the risk of percentage of myocarditis overall? If you don't get the vaccine and you get COVID, would you get myocarditis? Yes, you could possibly. But I think the incidence of the myocarditis related to the vaccine is much less. It still is much less. I think it's 2 per 100,000. And I think that's out of 2 million people that they studied. So that's still a low percentage. And those kids may get sick, but they have not, a few have died. So I won't give you the number on that. But so you have to be very careful. This is your kid, your child.
Yeah. So, so the 5 to 12 years old, it's still in a clinical trial. And are you aware of when that will be done?
It's later this fall. So probably may have started, it may be completed by November, December. They're just starting that for the young kids. So 12 and under, and I'm not sure about 5 and under. So I think they separated the categories because babies are different from 5-year-olds, are different from 12-year-olds. So they are looking at what the proper dosage is, what the response is in those children, and how those kids behave, and if there's any side effects, as always.
I wonder if the parents would choose to do a homeschooling then, because the rate of statistic of children getting COVID infections is very small in the United States compared to Indonesia, for example. Last week, I interviewed this pediatrician who said that every 8 adults who get infected with COVID and 1 children get infected. And then the rate of the death among the infected children is, I think it's 0.5%, even though 0.5% seems to be small, but it could be your children.
Right.
So, and they do not have vaccination among children, not even, like
anything.
Young adult. Yeah. So why don't we talk about prevention? Maybe people who listen to us would really love to know, what do we do for prevention, right? So maybe I should share with the community what I do in my office.
Okay.
In a while, right? Yes, go ahead.
Well, I think overall we want to just stress how to protect your immune system, because that's what this is all about right now, because COVID's going to go from a pandemic to an endemic, very localized outbreaks here and there. And you don't want to be part of that outbreak. So you can protect your immune system. I think we talk about this frequently. And one of my friends said, well, nobody's ever, he doesn't want to get the vaccine. He says, well, nobody's ever talking about what you can do besides that, like nutrition, nutritionals and supplements and even the right drugs. He says, nobody wants to talk about it. I said, I talk about it. He says, well, you're the only one. So I said, I'm not the only one. We aren't the only ones. So you get started, Dr. Maria, and we'll go from there.
Yes. Well, people know how I practice. So in my latest book that's called No Code Medicine, I actually describe how to stay healthy. But now people probably ignore the last 3. So let me tell you the top 4. Okay. The first one is detoxification. If you realize you live in a toxic world, don't add more toxin to your body. Those are like, smoking and alcohol and things like that. So many people are aware that they are also have a high mercury, high lead, high arsenic. So how to reduce that is probably you have to think and save the money to detox your body first. Some people have fatty liver. Some people have a very low function of their kidney, and liver and kidney and lung. Those 3 are big organ for detoxification. And obviously, if you're constipated, do something, because if you're constipated, you are toxic, period, right? And
Right.
our skin also is part of the biggest organ for detoxification. So last week or last 2 weeks, I think, I interviewed Dr. Nayan Patel, who I am so grateful that he came out to my YouTube live and explaining what is so special about his glutathione revolution. Now we know glutathione is amino acid. We have been using it for many, many, many years, 200 years. And what happened, whatever we used in the past was injectable, and then delivery system, better one came. And then so we use it as a capsule forms, and then liposomal forms where it get absorbed in our mucous membrane in our mouth, right? And
Yes.
now what he does, he patented a technology to reduce the nanometer of the glutathione from 600 to 1 nanometer. And he makes it so that it's in liquid form. So you can rub it on your stomach or anywhere outside. Okay, so it's topical, dermal
Mm-hmm.
topical, and then you follow the protocol. And what happened when you use that, the glutathione goes into the cell and then detox your cell instead of staying outside, which is the plasma. So
Right.
it also increase your immune system when you detox. When your immune system increase, that's when what you call innate immune system. And so you'll be able to get ready with your own antibody to fight whatever virus come in or bacteria. Now, that is what he introduced. So that's one of the way to detox. Or you can come into my office and we have the hydrocolonic to help you if you're constipated. And also if we do detox by IV. The second one, of course, nutrition. Do not eat anything that is more creating inflammation to your body.
Right.
Those are sugary, okay? And then also make sure your body is not too acidic. So if you are hooked to any kind of alcohol drinks, please,
And sugar.
it is sugar and make the body
Right.
acidic. 1 glass of alcohol, you need 26 cups of water to make it alkaline again. So you cannot drink 26
No,
cups
no,
of
that's not
water.
going to happen.
Yeah.
No. Right.
So that's diet, right? In non-inflammatory diet. And then, like you said, if we talk about nutrition, my patients are very open to nutrition because that's the reason why they come to me. Many kind of nutrition, but in reality, we increase our vitamin D3 level. We successfully now make the world understand what's vitamin
D.
D4, okay? And then we introduce the vitamin C, okay? Vitamin C that are two kinds, soluble and water soluble and fat soluble. I
Mm-hmm.
endorse the fat soluble more because it stays in your body and you save money. And that's ascorbyl palmitate. And then you do vitamin E. The vitamin E
E.
delta and gamma is not like delta variant. Okay, this is delta tocopherol made out of annantho seeds, and this is very good for increasing immune system. In fact, some cancer patients, when we support their health system, we give them this tocotrienol,
Yeah.
delta and gamma. And then there are so many other kinds like quercetin, and then we also introduce colloidal silver for immune system. So all of these you have to follow now while you are locked down, because this is a chance for you to study what is lacking, not including the stress. You have to reduce your stress because not knowing this situation, the whole world is under a lot of stress.
Stress. Right.
That will
Absolutely.
reduce your immune system. And some of
Mm.
my patients ask, why my vitamin D level was 80 and now becomes 40? I said, listen, vitamin D is used every day
Yes.
according to what your body needs. If your body is inflamed, you're under a lot of stress and you have cancer, you have infectious disease, but
Right.
you need more.
It
And
goes to work. It goes to work to fight the pathogens. It goes to work for you. So
Correct.
it's an artillery of vitamins and minerals and nutritionals that work. You have to do them. So the studies say, people say, well, I take vitamin D. Well, do you take C?
Mhm.
No. Do you take A? No. Do you take E? Well, you need the whole artillery system. You can't go out there to fight 1,000 people with one gun called vitamin D. You can't
Correct.
do it.
Yeah.
So you need all of this. And for somebody, it's great if you could get all your lab tests done and show your vitamin mineral levels.
I
That is
totally
that
agree.
is optimal.
Mhm.
Most people won't do that. So you want to know what ranges of vitamins to take. So for vitamin D3, because we use vitamin D3, if you do vitamin D3 50,000 units a day, that's kind of high, but it'll get you to your good range. If you do vitamin D2 and you keep taking it, it will change your biological system. So most doctors are giving prescriptions for vitamin D2, which is synthetic. You have to be careful with D2. You can't do the same thing with D2 and D3 at those levels. And then if you're going to, you need magnesium also. And it's really like a cocktail that you're going to take, a nutritional supplement cocktail. And then you also have detoxification, the right foods, the cocktail, rest, sleep is sleep, 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 sleep.
Yes.
Sleep is wonderful.
Actually, I like sleep. Yeah. I
Yeah,
love
yeah,
sleep. Yes. Some people said, oh, Einstein did not need to sleep. I said, oh, forget about Einstein. No Einstein today. We need sleep. Okay. Forget about him. He's
that's
gone.
right.
Yes. Okay, so Dr. Cynthia, I think
Yes.
we update this month, and
Okay.
maybe you can have like a take-home message. So summarize it in a few words here before I close because I already took more of your
Oh,
time now.
no problem. No, I love it. I love listening to you. I love it. So we talked about the Delta variant. We talked about masking up. I want you to be very, very careful out there. People are still pretty silly. I won't say the other S word. And you need to keep your distance because the CDC looked at that group in Massachusetts, outdoor, indoor. We're coming up with another holiday. People are lax. They're not taking care of themselves in terms of social distancing and masking. If somebody asks you to mask up, just do it. All right. And just don't fight people. Try to remain calm. And I don't know if you come up. So here's the bottom line: you could be reinfected if you already had the vaccine and you want to know what to do if you have a breakthrough. And you need to be able to look for the symptoms, the runny nose, the sneezing, sore throat, headache, loss of taste and smell, the same things that you had before. And you may not have those symptoms. Would you know to get tested? Probably not. Therefore, safety measures come first. Do what Dr. Maria and I said in terms of nutritionals and your diet and detoxification. Mask up, social distance, take care of your kids, and talk to your pediatrician about what's next for educating your kids and getting them back to school safely. And 400 colleges have mandated vaccines on college campuses.
There you go, 400.
400.
How many are there? How many colleges
I
are?
don't know. I don't know the total number, but 400 is a lot. So, and there's the big colleges too, like University of Michigan, where I am. So
Yeah.
they're mandating this. Yeah.
So the option is Zoom, right? The option you cannot
Zoom
come to
or and if they don't do Zoom, you can't go to school, so you're going to put off. So they're kind of forcing the hands of students in a generation where in that doctor list of people who answered the questions, there were only like less than 10% that were around 25 to 30. They're not answering, not even doctors. They're not even answering the question. They don't
the,
care.
yeah.
So young
Now,
doctors are a little different.
now we have a few more minutes if you don't mind, because
Okay.
I suddenly saw some questions here, right? So they asked about, your how many teenagers were in the trial that you spoke, Dr. Cynthia? Did
Oh my gosh. So I think there were like, 2,000, 2,500, somewhere between about around 2,500 in that clinical trial for 12 to 17-year-olds. And we talked about that last week, so I don't remember the exact, but it was a low number. So it was around 2,500.
That's pretty good. Good size.
So good size, but still low in terms of, how many kids are going back to school.
Mm-hmm. The next question is someone asked if fruit is bad for you. I can answer that. Fruits, I love fruits. And fruit, they are high glycemic index fruits and low glycemic index fruits. And some are acidic, some are alkaline. You can easily find this list when you Google it. But just to give you an example, if you eat a lot of, let's say, for example, pineapple, mango, and then moya, what is that called? Strikaya, okay? Those are very sweet, banana is sweet. But if you eat like all the berries, strawberries and everything, berries is low glycemic index, so less sugary. However, even among the berries, you have to be careful because right now is the season of blueberries, and
Yes.
that's the only berry that is acidic. That's what I mean. So be careful with the acidic one and with the high sugar fruits. And I love fruits. I bring fruits every day to work, and I eat fruits every day. You have any comment about fruits?
No, I agree with you completely.
Okay. So, and then I think that's they like your terminology of the total artillery system. So
Yeah.
that's good. That's
Bang,
good.
bang, bang, bang.
Yeah.
That's right. You got to take care of your brain, and so all that stress stuff. The things we didn't talk about monoclonal antibodies, which they're doing more studies on, and patients are getting them. And the emergency room, usually, if you go to the emergency room, had a patient who went to the emergency room with asthma, they said, and they tested him, he had COVID, and they sent him home. He got worse. They came back the next day. They said, "Oh, we forgot to give your monoclonal antibodies." Okay, come on now, doctors, wake up. And then the other is ivermectin, which we talk about, which is parasitical. And there's studies on that, but most doctors aren't using that at all.
Well, it's getting better and better, Dr. Cynthia, because I think they are pushing. I mean, all the frontline doctors, like Dr. Pierre Corey, Dr. Peter Megalo, they all are pushing, and they trying to confirm the studies. And many of my patients knows about this one. And then when they ask, of course, I'll tell them that if you eat vegetable, you have parasite. You eat fish, you have parasite.
Yes.
So I'll just give this to you. It's for your parasites.
Parasites.
Don't think about this is a COVID treatment, but apparently what happened, they explain, there is like a spot, is called turpentine, and this ivermectin has the property that will lock that turpentine, and the virus cannot get in or escape. And that is similar like the glutaril theory of the detoxification.
Yes.
And some of my patients now, they accept that that they want to be vaccinated. Initially, they ask, should I be vaccinated? No, I know this is a trick, okay? If something happened to them. So I said, listen, okay, let me explain to you what do we have here for a vaccine, and then you decide. And then they went home. Oh, I'm not going to get vaccinated. I'm so scared. Okay, they went home. But then the children said, Mom, it's we can go for Alaska trip in the cruise and things like that. So they went. You know what? When they came back, one person in the cruise got the COVID, and they all were notified. It's like 400 of them, or usually 1,000, right? But this is not that much. And then so many people got infected. I mean, some of them were positive PCR, some of them were negative, but they have symptoms. So I have also patients do not have symptoms, but they are positive. So this is
it's very tricky.
This is very
tricky.
Yes.
So the other thing I've just been reading about the mandates for the teachers, doctors at hospitals, universities, schools. I love films, and I go to Sundance Film Festival, which is next year, 2022, mandates vaccines. You have to have a vaccine card. So somehow, and it's all employer organization related. So you can't say, well, I don't have the vaccine, I don't believe in it, so you can't come to the festival. That's it. You're out.
That's it.
So it's like a card. It's like the government stimulus card. Here's a check, here's a vaccine, here's a marijuana card, whatever, whatever you want. So these cards are
Right.
going to stack up at
Right.
some point in time. And but the thing about the vaccine, and people say, well, you're for the vaccine, aren't you? You're against it. I'm not one way or the other. You make up your own mind. I just have to read the data, look at the data. That people who are vaccinated, fewer die. You may not have symptoms. You may have have COVID, but it's still up to you what you want to do. But layers of protection are what I'm talking about. And if you're not going to do what we talked about with prevention, with detoxification, a good diet, vitamin A, B, C, D, all of those, then you're at risk. You're leaving your whole immune system at risk. And you have to make a decision. It has to be logical, well-based. I ask my patients every day, I'm afraid of getting hit. Have you had the vaccine? No, well, don't even ask me the question. And so I just kind of ask, have you had the vaccine? That's the question. All right.
Oh, no, I just asked, have you had the vaccine? Because I want to see your antibody.
Yeah, but that's not my situation. My situation is I might get hit. So
Oh,
people are angry. They don't want to be asked. I'm in Detroit. The 36%, 40% vaccination rate. You don't ask that question.
uh-huh.
So
Okay.
it's a different world.
Okay.
Endemic. I know California is on the rise, and so is Florida, and so is Mississippi and Louisiana.
Oh, yes.
Low,
California
but
gets everything. Yeah.
yeah,
Because
yeah,
we are multicultural also.
right,
Mhm.
right.
Okay. Well, thank you so much for
Okay.
all the information, and stay healthy, because we
Yes,
have
stay
to meet
healthy.
again in August. No, this is August, in September.
September.
So September will be another way. Okay, just a second. Okay, I think that's it. Thank you so much, Cynthia. And this
Thank
is
you.
Dr. Cynthia. Give your thumbs up for Dr. Cynthia about this update. And this is Dr. Maria Solindro, practicing in Pasadena, California. We both are doing integrative medicine and anti-aging. Bye.
Bye.